is on antimicrobial resistance, which some people refer to as AMR, is when microbes are less treatable with one or more medications used to treat or prevent infection. This makes these medications less effective in both treating and preventing infection. Here with us today to join us are Pilar Ramon Pardo, Mark Springer, and John Boyce. We have a full lineup here today.
There is a change in the name of the hourglass.
Oh, okay. So instead of John Boyce, we
Arthur Phillips.
Arthur Phillips. Thank you very much for joining us this morning. Pilar works with us here at the Pan American Health Organization as advisor for antimicrobial resistance.
Okay.
Mark Springer is the director of AMRM Secretariat.
And Arthur is coming in representation of the Ministry of Health.
Great, thank you very much.
From Barbados.
Yeah, thank you very much. So in terms of antimicrobial resistance, what is the impact and consequences of antimicrobial resistance in the daily life of people?
Okay, thank you so much for the question and also for the space. I think that this is a very important question that should be responded in different levels.
Sure.
So we will appreciate the comments from the country perspective, from Barbados, and also from the global level. So you will have a nice insight about the different levels of relevance.
Excellent.
So maybe you can start.
Okay, sure. I'm thinking that it's probably not immediately apparent to the average person in the street the impact of antimicrobial resistance. They're probably experiencing the impacts without even being aware of it. So that they're going about their daily life, and for example, they may be consuming meat from animals that have been fed on antibiotics in order to reduce their rates of infection and to increase their rates of growth. An individual may be self-medicating for a condition that they assume is caused by bacteria, and therefore they've obtained antibiotics from someone else over the counter, and they are using these antibiotics because they believe that they will resolve a problem that they have by self-medicating. An individual may be even interacting with a healthcare provider and having been prescribed antibiotics, but they may have been prescribed antibiotics inappropriately and therefore may be at increased risk of experiencing resistance and consequences in terms of unresolved infections, other complications, increased length of stay, hospitalization, and knock-on effects in terms of cost to the country. So for a significant number of individuals, they may have no awareness that this is an issue that they're interacting with. But we can see how easily and how simply this issue may be played out just on a regular day in an average person's life. Yeah?
Great, thank you. How would you like to add your perspective on that in terms of the impact and consequences of antimicrobial resistance in the daily life of people?
Yes, now if you look, modern medicine depends on the use of antibiotics. Yeah. It's very important not only to treat a patient with pneumonia, but also to prevent an infection if they get a hip replacement. Today we know that over 25,000 people die due to antibiotics that are not working in Europe, and the same amount of people in the United States, and a lot of other people die because they are not working.
Sure.
We also know that 50% of the antibiotics are not used in the right way. So we really need to reduce the amount of antibiotics that we are using. Now, I have 4 children myself, and of course they have often an infection. But if you just wait, you will see that they don't need antibiotics because a lot of infections are due to viral infections, and antibiotics will not work. So just wait and see. That's important.
Great, thank you.
And also it's important to mention that the implications are now, but will be worse in the future. So it's estimated for 2015 the burden of antimicrobial resistance, the number of deaths will be higher than the deaths from cancer. So also we have to prepare ourselves for the future and to trying to protect the antibiotics because they are a social good.
So our time's a little bit limited this morning, but just real quickly, how can people, what can people do to contain antimicrobial resistance? What can they do?
Now, of course, only use antibiotics if they are prescribed by a doctor.
Yeah.
Just follow also the instructions, and you need to finish, your therapy.
Sure.
That's very important.
And I think the issue of packaging and getting those messages out is very, very important, because individuals may not fully understand what has just been said so clearly, and countries and practitioners and institutions need to make sure that we communicate these messages clearly to individuals so that they understand them, and we need to ensure that we're constantly training providers so that they can appropriately counsel clients so that they can understand the benefits of cooperating and trusting in the providers in terms of appropriate prescribing.
Exactly.
Thank you very much to each of you. Really appreciate your help and your time with us this morning.
Okay, but we have very short time. We were thinking maybe 10 minutes and also to mention the
I'm sorry,
campaign.
no, it's a we have to move on to the next topic. But thank you so much again, yeah?
So thank you for
Thank you.
the opportunity.
Okay.